Good afternoon. Good afternoon. My name is Eli, and I'm going to be your student nurse today. Before we get started, can you tell me your name and date of birth? Okay, I'm going to double check that with the system. And everything seems to check out. Okay, Mr. Wayne. Now, before we continue, can you tell me if you have any allergies, such as betadine, iodine, or latex? No? Perfect. All right, I'm going to grab some gloves. So, Mr. Wayne, the doctor today has ordered the insertion of a Foley catheter. Now, all that is it's a tube that we are going to insert into your urethra. It's going to travel through your ureter and end up in your urinary bladder. Essentially, it's going to assist in voiding. Now, you may experience some discomfort throughout the procedure today, but hopefully we're going to work together and minimize that as much as possible. Now, before we can actually begin the procedure, I do have to administer some perineal care. All that means is I have to clean the area where the catheter is going to be inserted. Is that okay? Perfect. Now, the two most important things to keep in mind today are, number one, at all times, maintain a sterile field. You'll see that come into play, especially when we actually begin the procedure. And number two, to maintain patient dignity. That is key at all times, which you will especially see when cleaning the perineal area. We will grab Emerson basin, bucket, has many names, a damp rag with soap and water, and a dry rag. All right, Mr. Wayne, we're going to clean the area. Soap and water. And then we will pat it dry. Cover the patient back up, patient dignity. Remove the contents. Remove gloves, dispose, practice hand hygiene. Now, we're dealing with a male patient today, so we want to place the patient in a supine position with their legs angled outwards, and then we can begin the actual procedure itself. You want to grab your package and the contents there within, place them on the bed between the patient's legs. Now, another thing I have to make a note of. As we're in the middle of the COVID-19 pandemic, we're obviously not in a clinical lab at school, and we don't have all the tools or even a mannequin to actually do the procedure on. So throughout the video today, you may see at times I move the water bottle a little or something such as that. Bear with me, we're doing the best we can under the circumstances we have. You will begin, once again, maintaining that sterile field. Remove the contents of the package. Keep them placed between the patient's legs. Now, this bag right here, you would normally place it at the foot of the patient. We're going to place it right here. It's going to be used throughout the procedure as a disposal of sorts. You will begin grabbing no more than the edges, maintain a sterile field. This may work better or worse than a freshly packaged catheter kit. Obviously, we use this one a bunch, so it may fold back on me or fold perfectly. You will remove certain contents before you even begin. We don't need them at all. This, dispose. This, dispose. When disposing, never actually touch the bag. Drop it from a few inches of an elevated height into the bag. Perfect. Perhaps the most important part of the kit, other than the catheter itself, sterile gloves. We want to grab just the edges and remove those from the package. Carry them over to another surface. Unfold the gloves. Once again, sterile technique, only touching what is absolutely necessary. That looks about good. Okay, and we want to start with our non-dominant hand. That's what I do personally. Gloves may work perfectly when placing them on the first time, or not at all. It's all to the discretion of the moment. We're going to stop about right there. For the second glove, we'll go under the cuff right here. I will angle my hand down and in like so. Now, when you want to adjust your gloves, you will pinch and pull. Gloves are on, now we can practice sterile technique. Now, you have a second sheet which must be used. As you can see, it has two different characteristics. You want to place the shiny side face downward on the bed between the patient's legs. All this is going to do is extend the sterile field for us. We'll take this packaging right here and move it out. Now, much as we cleaned the perineal area earlier, we must do the same thing again. The reason I asked about betadine allergies earlier, you've got betadine. Dump it into the bucket, dispose. Now, we must clean the glans meatus of the patient. We're going to take our tongs right here. We're going to use 3 cotton swabs one at a time. Dip it in the betadine, grab a hold of the patient in a firm but gentle motion with our non-dominant hand, and with a cleansing motion, we want to do it in a circular fashion with the betadine. So 1, dispose, 2, dispose, and then 3, dispose. Also dispose of the tongs. Next, lubrication. Catheter may meet a little resistance, so we have to lubricate the insertion point. So you'll once again grab the patient, insert all 10 cc's, essentially the entire vial of lubricant, into the patient's into the meatus. Dispose. Finally, we need to ensure that the catheter is working before we insert it. So we will remove the sheath, dispose, and then we have to inflate the balloon. So find the port of the balloon, uncap the syringe of sterile solution, place it in the port, find the balloon, and then ensure that it is in fact inflating appropriately. Looks to be so. Perfect. You will allow the balloon to deflate on its own. Can take anywhere from 10 to 15 seconds. Almost there, almost there. And we're just about done. Perfect. Keep the syringe in there. A few instructions for the patient. Okay, Mr. Lane, we're going to begin insertion of the catheter. Now, when we do so, I'm going to count down from 3. And as I count down, I need you to bear down as though you were attempting to void. When I do, I will begin insertion of the catheter, okay? All right, on the count of 3, Mr. Lane. 1, 2, 3. Okay. Begin inserting the catheter. Great job, Mr. Lane. Encourage the patient. For male, you want to insert the catheter all the way to the Y. The catheter is in all the way to the Y. Once again, inject all 10 cc's of sterile solution into the balloon. Remove said syringe, and then pull back on the catheter until you meet resistance. That's when you know it's in the appropriate place. Grab the patient, pull them up in a 90-degree angle, and tape the catheter tubing to the patient's abdomen. Next, you will take the specimen bag and place it beneath the bed. Now, obviously, we don't have the appropriate tools we need, but you would take this hook and hang it on the hooks where you would place the restraining cuffs. Not on the arms of the bed, but on those hooks. You want to keep it beneath the patient's bladder, their stomach, and above the floor. Now, you may be instructed at any time to collect a specimen. If so, there's 2 manners you can do it. If you need an immediate specimen, you would come to this blue port right here. You would cleanse with an alcohol swab, get a fresh syringe, and remove said specimen. If you just need a specimen, period, you can take it from the bag itself, but you must keep in mind that the specimen at that point may be a few days old, and if so, may be contaminated with a little bacteria. The catheter is in, assess for any urine return. Now, catheter's in, has been taped to their abdomen, bag has been hung. Before he can leave, we need to clean the betadine off of the patient. So, once again, grab our bucket, grab our water, grab our rags. Remove betadine, dry patient, and begin to collect contents. We will remove our bucket. We will begin to collect these. We will set our syringe to the side. In a normal procedure, you would get a fresh syringe later in the procedure, but for the sake of the tools we have at the moment, we will reuse this one again later. Set it to the side and begin to collect contents. Set dirty used contents to the side. Remove sterile gloves. Place patient in the bed in the lowest setting possible. Set up the 2 side rails, not all 4. The patient may feel restrained. Assess for any signs of discomfort. Maintain patient dignity. Cover them back up. Ensure that you will be back soon. If they need anything, they can call on you. Okay, Mr. Wayne. Well, the catheter has been inserted. The bag has been hung. The procedure for the moment is done. Upon the doctor's orders, I will return. If you need anything at all, do not hesitate to ask. I will return again soon. On your way out the door, once again, as always, Hand hygiene. Good afternoon, good afternoon. All right, can you confirm your name and date of birth for me? All right, I'm just gonna double check that with the system. Mr. Wayne, it's good to see you again. Let me just confirm the doctor's orders. Let's see here. Removal of catheter tubing. Okay, so we can go ahead and remove the tubing. I'm gonna grab some gloves. Okay, now, syringe we mentioned earlier. Normally you would grab a fresh syringe to deflate the balloon when you go to remove the catheter. We only have one syringe in our toolkit, so this is the one I will use again. We'll bring it over here. Untake the tubing from the patient's abdomen. Now normally you place a towel, which I don't have on me at the moment, beneath the patient's legs, just so that throughout the removal, if there's any spillage or things of that nature, the towel will be there to clean it up and maintain a sterile field of sorts. Once they are untaped, grab the patient, uncap the syringe, place it in the port from earlier, and once again, allow the syringe to deflate on its own. It may need a little push in the beginning, but other than that, as you can see, it's beginning to deflate on its own. Once again, can take anywhere from 10 to 15 seconds. It's probably good to have a little small talk ready for the patient. Just assess how they're doing, ask if they've had any specific pain, any discomfort, how their experience has been, if they need anything, things of that nature. So the syringe is about 6 cc's at the moment, so it is almost to completion. You're doing great, Mr. White. Doing great. So the syringe is almost fully, there we go. So remove syringe, cap it, set it to the side. Once again, instruct the patient to bear down as though attempting to void when removing the catheter. All right, Mr. Wayne, you know what to do on the count of 3. 1, 2, 3. Balloon is deflated, catheter has been removed. Unhook the specimen bag, place the contents in the towel, wrap them all up, remove them from the patient's bed. Contents are all collected over here. Take off gloves, they're not dirty. Once again, maintain patient dignity, cover the patient up, assess for any signs of discomfort. Once again, make sure bedding is in the appropriate position, make sure rails are up. All right, Mr. Wayne, well, the catheter procedure is done. It has been an honor to take care of you. I hope that you sincerely get to feeling better, and if you need anything at all, do not hesitate to ask. You would carry the contents of the procedure out with you. Hand hygiene, one more time, leave the patient's room.